Everyone to this session of today. My name's Masereka Pedson. I come from Uganda and I am professional health worker and a health tutor. I hold a bachelor's of nursing science and I hold also a postgraduate diploma in medical education and a master's in nursing science. I will be teaching and taking you through pathophysiology, and this course unit encompasses or describes the cellular changes in the body and how those cellular changes in the body affect the normal well-being or the normal functioning of the body. In other words, our cells are made in such a way that they perform a normal way when they have no disturbances, and the presence of these disturbances also therefore alters their normal functioning. So we shall be looking at how normal cells behave and the abnormalities that may come out when these cells are disturbed, and therefore this course unit describes the abnormal changes or the abnormal functioning of the cell so that we are able to recognize those abnormalities from the normalities, as we are able to detect and prevent them from occurring or them from persisting and cause complications. So the topic that we are going to talk about is cellular changes in the body, and the objectives for today is one, we are supposed to by the end of this session be able to define pathology. We shall be able to differentiate between the different types of cells, cellular changes in the cells, and we shall be able to do what to identify examples of each processes in various organs and tissues. We shall also be able to understand the potential consequences of these changes, including precancerous conditions. So those will be our guiding objectives for this lecture, and I welcome everyone to pay attention and we move on very well. To begin with, we shall move to the definition of pathophysiology. So pathophysiology is a broad field that encompasses the study of disease processes, including their causes, mechanism, manifestations, and effects of the body. So pathophysiology is a field that looks at how these cells come to function in an abnormal way that is intended, either that is caused by either the presence of an injury or the presence of an environmental factor or an infectious agent. So we shall also look at how do these cells come to that state where they fail to perform the way we normally need them to perform, and what happens when they fail to perform, what happens to them. And that one we shall look at the effects on the body when they fail to perform. So in this way, in other words, the signs and symptoms, or there are those evidences that may alert us that our cells are either disturbed or by either an injury or there is an infectious agent in our bodies that has resulted into an abnormal functioning. So this pathophysiology will have a scope. There is where we are limited to discuss and describe. So pathophysiology does not go everywhere. There is a certain scope where it deals with investigations of all aspects of disease, ranging from macroscopic observations and microscopic changes. So we shall only look at or focus on how the structures of these cells in terms of their shape, and the size macroscopically without using a microscope? How do these cells change in shape and in size when they are invaded with an external substance or an external factor? These factors may be environmental, genetical, they may be microorganisms. How do they look macroscopically without use of the microscope in terms of organ size and appearance? So with microscopic changes, we look at the cellular abnormalities. How do these cells change in terms of size, structure, and function? So we are saying these cells are within organs, and these organs depends on the functionality or the well-being of these cells. So the microscopic changes looks at the cellular abnormalities. When these cellular abnormalities are present, of course, they can also cause organ abnormalities in terms of organ size and appearance. So the microscopic part looks at the cellular abnormalities, whereas the macroscopic observations looked at the size and appearance of organs through which these cells are embedded. So the definition of pathophysiology, as earlier said, it is the study of the physiological processes and changes that occur in the body as a result of disease or injury. So when these cells of ours within the bodies are not invaded with microorganisms or diseases or injury, there is a way they form, or there is a way they work under normal circumstances. But under the presence of either a disease or an injury, their functions or their physiological processes are deviated from the normal, and these ones are the abnormalities could be evidenced by either symptoms or signs. The symptoms are those evidences of experience or that are experienced by the person. Someone may tell you, I feel headache, I feel pain, I feel nausea. Those ones indicates a cellular disturbance that may end up giving us observable evidences such as signs of failure of an organ. So pathophysiology in brief is the study of the physiological processes and changes that occur in the body as a result of disease or injury. The word patho means abnormal, then physiology means functional. So in pathophysiology we shall look at what are those abnormal things that make our cells function in an abnormal way. So it explores how the body normal functions are altered in various pathological conditions. If someone has pathology of the cells of the kidneys, how does the kidney alter their normal functions? We are aware that the kidney is responsible for majorly filtration of blood and formation of urine. So if these cells of the kidneys that are responsible for this function of filtration of blood and formation of urine are damaged either by an injury or invaded by microorganisms and the disease result, how do the formation of urine become altered by the cells of the kidney? So that study is what we call pathophysiology. It explores how the body normal functions are altered in various pathological conditions. So as we look at this course unit of pathophysiology, we need to understand why this course unit is very critical to health workers or to the clinical setting, or why we should be able to understand the deeper knowledge about the functioning of these cells and the changes that may occur as a result of disease or injury. So understanding pathophysiology is crucial for all of us as healthcare professionals, in that it helps us to diagnose and treat diseases effectively. We cannot diagnose a disease unless we know the normal functioning, and we make a diagnosis depending on the abnormalities that have been either reported to health workers by patients using the symptoms, or by diagnosing them using visible evidences that we call symptoms. But we cannot know that this one is an abnormal unless we know the normal, and we come up with that after understanding the pathophysiology knowledge. So another reason to why we should also understand pathophysiology is that it provides insight into the underlying mechanism of disease, aiding in development of targeted therapies. So this knowledge and deeper understanding of pathophysiology helps health workers to understand the mechanism of disease. How do these conditions come about? When a certain cell is damaged, what processes does it go through? What are the series of events that take place before the signs and symptoms occur? Or what processes do this cell go through in order to show the signs and symptoms? And we call that knowledge known as pathogenesis. And with this knowledge, it aids us in developing targeted therapies. It helps us to strategize which drugs should we use in order to stop this from happening to ourselves. And in addition, it also helps us in predicting and preventing the progression of the disease. So when we know that these cells, when they are invaded by a certain microorganism or is damaged by a certain by an injury, it has to pass through these series of events. So if at all we make investigation at a certain point, we are able to predict, if we don't intervene at this stage, what are we likely to have in the next few hours or in the next few days, months and years. So in order to come up with how much and which drug should we come to interfere with the progress of this disease. So if this one is not done, what may come out? So that knowledge or that decision making comes as a result of us having understood the knowledge and the basics of pathophysiology. In addition, the key components of pathophysiology are, in order for us to understand this deeper pathophysiology and appreciate its applicability in the healthcare setting, we should be aware of these concepts or key components. And one of the key components are we have etiology. So this is the study of the cause or origins of the disease. So all conditions or all abnormalities that occurs within our cells must have a causative agent, must have a source, must have the origin, and that origin we are calling it a cause. That cause is etiology. So someone may come up, may be well during the day, but during the evening or during the night he develops abnormalities, and those abnormalities must have a cause. There is nothing that occur without a cause. Sometimes they say there is no smoke without fire. So our smoke in this case is the abnormal functioning, and the fire in this case is the causative agent. So this implies to us that all abnormalities that occurs to our cells must have the origin, must have the source, and we cannot manage the abnormalities unless we have tackled the source. And knowing this the source or the cause of the pathophysiology will help us in strategizing the preventive measures, so that we don't get into contact with the causative agent. For example, infectious diseases will always occur unless there is an infectious agent. So someone will have malaria unless she or he is having microorganisms called Plasmodium vivax or malariae that will have caused someone to get malaria. So the causes of these conditions that occur to our body cells and disrupts their normal physiological process may be genetic factors, may be infections, may be environmental influences. So the environment we live in may be the causes of the abnormal functioning of our cells. The second key concept is pathogenesis. That one is referred to as the series of events that develop and determines the progression of the disease. A series of events that occurs within the cell that leads to the development and progression of the disease. In other words, it is the mechanism through which the series of events and the mechanism through which these cells go through in order to become disabled to function normally. And it describes how the disease evolves from the initial state to its final expression. What happens when microorganisms invade those cells? What happens when those microorganisms stay in the cells? What changes do these cells go through to become stage 1, to become stage 2, to progress to stage 3? And remember, the rate at which these conditions progresses through is the same as the severity of this condition that may occur. So as earlier said, etiology refers to the study of the causative factors or origin of disease. The spelling may differ depending on which country you prefer to use. For example, the commonly used countries such as UK uses etiology that starts with ETIO. So and that is without A, and this does not change the meaning. For the term originates from a Greek word ensia, which means cause, and logos, which means disclosure. And understanding the disease etiology is very critical for identifying risk factors, implementing preventive measures, and developing targeted interventions. As we have come up with the previous slide, when I talked of we cannot prevent unless we know the source. You can't say by preventing someone from getting malaria, we should either sleep under mosquito net unless we know what causes malaria and what spreads it. So if, for example, someone has tuberculosis and you say tuberculosis, to prevent it, you should sleep under mosquito net, you will never prevent its spread, because the causative agent of pulmonary tuberculosis does not spread through bites of a mosquito. So unless we know the causative agent, it is when we are able to identify preventive measures or to prevent the risk factors. In other words, to avoid them. We cannot say we should avoid getting into contact with the mosquitoes in order to prevent tuberculosis. No, because tuberculosis is caused by a different causative agent that is different from being exposed to mosquitoes. And these diseases are also classified depending on the causative agent. So when we look at disease classification, these diseases are classified depending on the causative agent or the cause. They are classified according to etiology, according to the source. So as these diseases, not all diseases or not all not all disturbances that occurs within our cells are caused by the same factor. We have different factors that may cause our cells to perform abnormally, to cause an alteration from the normal physiological process that is called pathophysiology. So cells may function abnormally when they are having genetic diseases. So genetic diseases may result from inherited mutations and these abnormalities which may be passed from parents to offsprings. So genetic diseases are those diseases that one is born with, but the genes or the characters are passed from the parents to the offsprings. Of course, we know that genes are character determining factors. So if, for example, we have in our cells, we have red blood cells, and the red blood cells are responsible for transporting oxygen from the lungs to our tissues. Now, if their structure is altered, it means the ability to transport this oxygen is also going to be deviated. And we are aware that a normal red blood cell is supposed to carry 4 molecules of oxygen per saturation. And it means if the structure of these cells are altered, one, it means the affinity for oxygen is going to be altered, and the amount of oxygen or the quantity of oxygen carried is also going to be altered, and this may be determined by the genetics or the genetic makeup of these cells. For example, we have diseases such as sickle cell disease and cystic fibrosis. So these ones, if a mother who is a sickler gets pregnant, the chances of her delivering a sickler or a carrier are higher than in a non-sickler mother. So those inherited conditions are called genetical conditions, and that is the reason to why family history is very important in assessment of health issues, because most of the diseases may be inherited, and that is the reason to why we should not say all diseases should be having the same source. No, different diseases have different sources, and different sources are also approached differently depending on the cause. So in addition, the second class is the congenital diseases. Second classification of diseases is congenital diseases. Congenital diseases are diseases that arise in fetal development or intrauterine. These are conditions or abnormalities that may occur onto our cells that may deviate from the normal physiology of the cells as a result of the abnormalities or abnormal events that precipitated these cells to either develop poorly or to continue being developed poorly. And these conditions are influenced within the first 3 trimesters of pregnancy. So the first trimester of pregnancy, those are the first 3 months of pregnancy, are very important to healthcare workers, because those are the 3 months that are determinant for the development of organs and cells within the fetus. So sometimes mothers do take poisonous chemicals such as drugs during pregnancy, especially when they have self-medication. When a mother gets sick and he says, let me go and take this drug, it is going to help me. I have been taking it when I wasn't pregnant, so it is the same drug I'm going to use, without knowing that these drugs, sometimes they may be safe to the mother but fatal to the fetus. Especially we have thalidomide, we have warfarin, and it is also very important for us health workers to be conscious in prescribing these drugs when someone is pregnant. So those drugs may cause an abnormality, they may cause a dysfunction, they may cause a dysdevelopment in the cells during fetal development, and you find that at most of the times these babies are born with congenital abnormalities, and these congenital abnormalities could either be in a deviation in the structure of these cells, or they can be a deviation in the size of these cells, or it can be a deviation in the function of these cells. They may be anatomical congenital abnormalities, or they can be physiological congenital abnormalities. So, for example, congenital disorders may include conditions like fetal alcohol syndrome, especially if this mother was taking excessive alcohol during pregnancy that went and caused havoc to the cells of the fetus, and the baby is born with alcohol fetal syndrome. So this results from the maternal alcohol consumption during pregnancy, leading to the development of abnormalities in the offsprings. And the third class of the third class of diseases, we have acquired diseases. So the acquired diseases are those diseases that the offsprings or anyone else of us can get from our environment, from the people we associate with, from the surroundings, from what we touch altogether. So that one, those conditions are called acquired diseases, and we are saying these may develop after birth due to exposure to pathogens. If a baby is born in an environment with microorganisms, likely to get those pathogens, and those pathogens, when they invade the body, they will cause disability. And we are saying there is a wide range of conditions, including infectious diseases such as tuberculosis. If this baby is received by a health worker who has Mycobacterium tuberculosis, then the baby may also get these microorganisms. If this baby is born in an area that is full of microorganisms, where we put this patient, where we put this baby, where we touch, the instruments we use could be sources of the infections. So those conditions that someone acquires either from one person to another or from the environment. For example, if someone works in an environment that is full of toxic chemicals, one may also get either lung cancer because of being exposed to those toxic chemicals, and those chemicals interfere with the normal physiology of the cells, and still that one, the condition that will arise will be classified as acquired diseases altogether. So these acquired diseases may either be communicable or non-communicable, and these acquired communicable diseases are the ones that we get from the affected people and being spread to other people, whereas the non-communicable may be due to our lifestyles or exposure to the environment. For example, diabetes mellitus type 2 is due to lifestyle. It is acquired. It is acquired after you not controlling your carbohydrate intake, and those ones are classified under acquired diseases. Hope everyone is at par with me, and in case please you don't understand, remember to contact me. I will leave my contacts, and whenever you want to ask, please, I'll be available. Hoping we are all at the same pace, and we are going to look at the next thing known as the symptoms and signs and symptoms. So in pathophysiology, what alerts us that there is an abnormal functioning of the cells? When there is an abnormal functioning of an organ, there are some indicators, and these indicators are either felt by the patient, or these indicators are also visible to our health workers or measured. So these indicators are either symptoms or signs. So what is a symptom and what is a sign? So a symptom is a subjective experience reported by a patient, and these may be pain, fatigue, or nausea. So most of the times when we are assessing these patients, they always have present complaints or presenting complaints, and these presenting complaints could be either subjective, is what is felt by them. For us, we don't feel them, and these presentations or these experiences are what we call symptoms. Symptoms are experiences felt by the patient. For us, gives us directions of where should we examine, where should we put our focus in order to get a comprehensive history, or to get a comprehensive picture of the state of this patient. So we also have a sign. A sign is an objective evidence of a disease or abnormality that can be observed or measured by healthcare providers, such as fever. Someone will tell you, someone will tell you that I have a skin rash on my body. There is something that I have not been with. I have not something different that I have not been with. And what is that? Skin rash. And when you examine really, when you expose the body, you are likely to see a skin rash. So what you see, observe. What you observe is a sign. And that sign may indicate an underlying disorder. An underlying disorder is that pathophysiology that is making this skin not to perform well and have signs and symptoms of a rash. Then we have fever. So someone may say, I have high temperatures, but those high temperatures, can you see them? No. You see them by using a thermometer. You measure that temperature. How much is it? So to do that, you should be knowing the normal values of these temperatures, whether it is high temperature or low temperatures. So if there is high temperature above 37 degrees C, it means the regulatory system of the body is having a problem, and what could be causing this to happen, what could be causing these abnormalities in our cells that are responsible for regulating the temperatures. And we are saying these high temperatures are very dangerous, and these are the signs that we can observe. And we can also observe and measure abnormal laboratory findings. If someone has high levels or elevated levels of white blood cell count, what does that one mean? If someone has a low levels of hemoglobin, what does that one mean? It means there are abnormalities within our cells, and therefore these cells are not functioning well because of an underlying cause. Therefore, these signs and symptoms help us to get or to identify or to get to an underlying cause, to recognize a specific disease. So these signs and symptoms are very, very, very critical, and when one is taking history, should pay attention to both subjective and objective data. In other words, you shouldn't rely only on the symptoms, on only what the patient tells you. You should also pay attention to go deeper and examine, measure, so that you comprehensively bring your symptoms and signs, so that you can be able to get a clear picture by exploring a diagnosis. So, what is pathogenesis? Pathogenesis, we said, refers to the process or mechanism by which a disease develops and progresses within the body, and the components of this progression. How does the disease start in the body? How does this cell start deviating from the normal function, either when it is injured or when there is invasion of microorganisms? Those events that occur within the cell are what we call, that process is what we call pathogenesis. So the components include the components are: the pathogenesis involves the sequence of events leading to damage, the pathophysiological disturbance and clinical manifestation observed in a patient. So the components of pathogenesis includes clinical manifestation, includes physiological disturbances, and these may also include these physiological and manifestations that are observed in the patient may be evidenced by either the patient and the health worker in terms of symptoms and signs. So the pathogenesis, these mechanisms may occur either within a shortest period of time. The disturbances may be rapid, or it may take a long period of time. The events within the cell that causes the cell not to function appropriately may occur at a certain speed. There is the speed that may determine the disturbances, depending on the nature of the cause of the disease. So, for example, we have microorganisms that are highly virulent, that when you get it right now, when they are evaded into the cells will fail to work within a shortest period of time. The signs and symptoms of disability of a cell will be evidenced within a shortest period of time. And there are some microorganisms that even if they enter you right now, you may finish like 3 to 4 months before the signs and symptoms occur. In other words, that time, that period of invasion of the microorganism to the time of showing up signs and symptoms is the incubation period. We have microorganisms with the shortest incubation period, while others have a longer incubation period. So those signs and symptoms that occur within a shortest period of time, when a cell is damaged by either environmental, by either genetical, by either infections, whatever may cause damage to our cells. So those signs and symptoms that may be manifested within a shortest period of time after the precipitating factor has occurred, we call that one acute or rapid onset of the signs and symptoms. In other words, we have the mechanisms that brings to the disability, that brings out disability of these cells may be occurring within the shortest period of time, and we call that one acute. When the mechanisms occur slowly and takes a long period of time for the signs and symptoms to occur, we call that one chronic. And we are saying the acuteness and the chronicness of events, in other words, the rapid onset or long onset of these mechanisms that occurs within the cell when there is invasion of microorganisms, when there is damage to the cells, that one depends on the nature and the cause of the disease. So when we have when a cell has been invaded or has been damaged, and there are some mechanisms that have occurred, there is pathogenesis, there are a series of events that have taken place within the cell, there are signs and symptoms that are evidenced both by the patient and by healthcare provider. But not all conditions may present the same, and other conditions also present the same. So you may confuse which of the conditions could I be dealing with, depending on these signs and symptoms. For example, if the patient says, I feel headache, I feel general body weakness, I feel abdominal pain, and when for you are observing this patient, looking for signs and symptoms, this patient would be either be having edema, either this patient is having jaundice. It comes to your mind, which condition am I dealing with? Yes, there is, depending on the signs and symptoms that have been presented, it is evident that there is an abnormal functioning of the cells. But what exactly am I dealing with? Therefore, you need to have investigations and you make a diagnosis. Investigation means you need to dig deeper, inquire, you need to research, do more research, investigative research about what you were dealing with, using the signs and symptoms that you have at hand, so that you are able to come up with a conclusion. A conclusion will be now the diagnosis. And by definition, diagnosis is the recognition of specific disease. So for example, with the signs and symptoms we have talked about of body general weakness, fever, abdominal pain, edema, and jaundice, how many conditions do we know that present with this? There are very many. Of course, one will have differential diagnosis as either one could be having malaria, either one could be having hepatitis B, either one could be having liver disease, either one could be having obstructive biliary duct. Those conditions will come up altogether. So you need to investigate, go deeper into understanding of this, what exactly out of these three to four conditions that I'm suspecting one to be having, so that you come up with either one or two conditions, those recognizable conditions, and we are saying those are the specific ones, and we are saying the recognition of specific disease, that process is called diagnosis. So diagnostic investigations aim to confirm or rule out specific diseases, conditions based on the clinical findings and patient's history. And that's why I said you should not ignore subjective information. You should also not ignore objective information or data. So the investigations may include laboratory tests, may include imaging studies such as X-rays or CT scans. They may also include endoscopic procedures and other diagnostic modalities. So on these procedures, we may have those invasive procedures and non-invasive procedures. So the invasive procedures are those procedures that requires tissue sampling or procedural interventions, while others that are non-invasive are not involving the patient's invasion of tissues, and these ones aim at improving or maintaining the patient's comfort. Of course, they don't have those sophisticated procedures to go into tissues, give painful episodes of pain to the patient and discomfort to this patient. Those ones are non-invasive procedures. But the main issue of all of this is to get more information about the situation that is at our hands, so that we are able to make conclusive findings that we are calling diagnosis. So what is diagnosis? So diagnosis involves identifying and characterizing a patient's medical condition or disease based on clinical evaluation, examination findings, and diagnostic test results. So when we are making a diagnosis, when we want to recognize a specific or a particular condition, we don't rely on single data. We don't rely on single information. In other words, we don't rely on subjective data. We don't rely on what the patient tells us. We don't only rely on what we find out on our observations only, but it is a combination of very many sources of data that will give us a comprehensive picture. For example, what the patient tells us, what we also ask the patient, or what we also measure from the patient, and the laboratory findings or the investigations that we may do, either the scans, the X-rays, and whatever. So if all of them confer to one, if all of them are pointing to a specific direction, all of them are pointing to a specific direction, then we come up with a conclusion of that direction depending on the agreement. These these subjective history have come up with, these objective history have come up with the examination findings and the laboratory findings. That comprehensive agreement will make us have an interpretation, and we formulate a final diagnosis from the differential diagnosis. So when we are making this diagnosis, accurate diagnosis is very essential for guiding appropriate treatment and management strategies for patients. So the reason why we all do this is that we should not waste patients' money. For these days, patients are the ones that do buy drugs. So if we make a wrong diagnosis, it means we shall prescribe drugs that are not actually going to help in any way. 2, we shall be wasting our time. 3, we shall also be wasting the time of this patient and increasing the stay on our wards or in our care. And of course, this patient will be having a lot of issues that she's going to pass through, and we are also going to be exposing this patient to complications, because there will be progression of the disease process as we delay treatment due to wrong diagnosis made. And it also helps us to get now the appropriate drugs and also be able to predict the outcome of our treatment. And that prediction of the outcome of the treatment and management, we call it prognosis. And therefore, as healthcare professionals, as someone who has understood and studied pathophysiology, you should be knowing how and why making investigations, why subjective data, why objective data is very important in making a diagnosis, and why making a diagnosis is very, very important. In other words, we should not treat blindly unless we know what we are dealing with, and that is after making a diagnosis, then we should be knowing what causes this condition. That one takes us now back to what we have covered as etiology. So after getting the signs and symptoms of this patient, the signs and symptoms will make us know that there is an abnormal cell function. Therefore, we dig deeper, that is making investigations so that we know what we are dealing with, that is recognition of a specific condition. After knowing what we are dealing with, then there is a task ahead of us to make a final say on which treatment should we give, or which approach should we use to manage this condition at hand. Therefore, this is called treatment. So the goal of treatment is to alleviate symptoms. In other words, to make sure that these symptoms are done with. For example, if someone came with the complaints of pain, have we dealt with pain? How do we deal with pain? How does this pain go away? How do we manage complications? If someone came with complications, how do we reduce on these complications so that we don't have further complications? And how do we restore or maintain optimal health and function in the patients with diseases? If someone came with either injury to the kidneys and is unable to produce sufficient amount of urine, how do we deal with the restoration of kidney function in order for it to go back to its non-disease form, so that someone is able to make a sufficient amount of urine so that there is no toxic chemicals that remain circulating in our blood. So the approaches of treatment includes modalities that may be medical interventions, that is, we may approach these conditions, and our treatment may be using pharmacotherapy, using drugs. We may approach these conditions using drugs. So these drugs, when they are used, because these drugs are also determined by the sensitivity to the causative agent, the sensitivity and specificity to the causative agent. Not any drug can treat any illness. No, not any drug can treat any causative agent. So the drugs are also determined by the causative agent and by the condition at hand, as determined by diagnosis and laboratory results, or by the investigations that we have done. So we can use drugs, that is the medical interventions, or we may use surgical procedures, surgical interventions, and we have also the nursing care during this process of treatment, surgical management. What other care can we give so that the well-being of this patient is attended to? For example, some of these patients come when they are worried of their prognosis. They need to be talked to. They need this care of daily wound dressing. They are unable to do their daily activities. So as nurses, as midwives, are we attending to their needs, the healthy needs? They have self-care deficit. Are we able to care to them for them to have a normal progress of the outcome, so that the care is comprehensive. Some of these disorders to ourselves may lead to permanent disabilities, and when they lead to permanent disabilities, we need to restore a bit and support these organs either to go to somehow normal, and also help these people to adopt, to cope up, and that is rehabilitation and supportive measures. So the approach, and another approach could be the outcome. So we are saying the successful treatment outcomes aim to achieve disease remission, symptom relief, or functional improvement in affected individuals. So our main issue here could be aiming to achieve disease remission, elimination of diseases, elimination of that disability to our cells, so that our cells should regain their normal physiological process, our patients should be relieved of pain, and there should be functional improvement in the affected individuals. So if we give treatment, we have aims. So in the evaluation part, there is prognosis. It is the prognosis that will evaluate our management interventions. So as we said, prognosis refers to the prediction or predicted outcome or likelihood of recovery from the disease based on various factors, including disease characteristics, stage, treatment response, and patient-related factors. So the predicted outcome, how the patient is responding, or how the patient is likely to respond today after treatment, or tomorrow, or after 1 week, or after 3 months. If there is normal, if this patient is responding well to the treatment, we may consider, if the patient came with the temperature of 40 degrees C, after 2 hours of administration of antipyretic, has this temperature gone low, or has remained the same, or has gone high? And if it has gone high, now what may happen in the next 2 hours if it remains the same? That is the prognosis, expected and predicted outcome. So the prognosis here may also be influenced by factors such as the disease stage. For example, someone in stage 2 may not respond the same way as in someone who is in stage 1 of the disease. Likewise, someone who is having stage 3 disease, let's say cancer, stage 3, and is started on chemotherapy, may not respond as someone who is having stage 1. So it depends on the stage of the disease. 2, it may also be it may depend on the type of the disease. Which disease are we dealing with? There are some diseases that delay response to drugs. They may take even 3 months to respond. Others may respond immediately, and they also may depend on the biological characteristics of the patient. We have different biological makeup, and therefore we have different immune system. Of course, these drugs are also boosted or supported by the immune system. If someone has a low immune system and we are giving drugs, there are some drugs they may suppress the immune system, and therefore someone's condition may deteriorate on drugs, and this would mean we use a low dose of drugs, a low dosage of drug, and that one will also mean a low response to the treatment. So it may also depend on someone's age. Middle age, extreme ages as in children and elderly. So the prognosis may be poor in either elderly and children because of their immune status and their biological makeup, and may be good in middle-aged or in adolescents. So the response could be predicted by the age of the patient, and of course the overall health status. If someone has already a pre-existing disease, for example, someone has come up with the pulmonary condition with a pre-existing disease of either heart failure, we expect a poor prognosis because of the pre-existing condition. So someone who has already a pre-existing condition and someone who doesn't have a pre-existing condition, their treatment response and prognosis is different. And the response to treatment may also predict prognosis. How faster you respond to treatment may predict how soon you will be well, or how long we will get well, or whether you will not respond well to treatment or good. Sometimes when someone is responding well to treatment, their days of stay in the health facility are reduced. But if someone has poor adherence to treatment, then the days of stay in the hospital or in our health facilities will also be lengthened. But also this one it depends on who is giving the drug. Is the drug that we have given the right drug? Is it the right dose? Is the route that we are giving the right route? And are we giving the drug at the right time? So all those factors should be put into consideration. So prognosis is very, very important to health workers because it helps inform patients. You may inform patients that in 2 to 3 days, I feel and I have hopes that this patient on this treatment is going to be better. In 2 to 3 months of sufficient and timely treatment on this drug, this patient is going to be well. So that prognosis helps us to inform patients. It also helps us to inform our caregivers, because most of these caregivers come with low hopes, or they may come with high hopes. Therefore, your prediction can be a positive one or a negative one, depending on the treatment that you are giving and the stage of the condition. X-rays, ultrasound scans, and we are saying all this data, the subjective data, the signs and symptoms, plus the laboratory findings and radiological procedures that we do. Also, when we bring them up, we have a full picture. If all agree pointing to the same thing, then we come up with a diagnosis. And we say the diagnosis is the recognition of a specific disease. And we said diseases cannot be caused by one particular source, and that source we called it etiology. And the sources of diseases, we said they can either be the infectious agents, they can either be genetical, they can either be acquired altogether. So we said the diseases can also be classified now according to those sources. Therefore, we said we have acquired diseases, we have congenital diseases, we have genetical diseases, and those led us to what we call diagnosis. And we said diagnosis is very important in that it helps us to identify which condition we are dealing with, so that we can be able to get a right treatment, and the right treatment will help us to either alleviate the symptoms or to eliminate the causative agent and restore and restore the normal physiology of these cells, so as our patients could be able to go back when they are happy, and the caretakers go back when they are happy. And we said this treatment of ours may also help us to predict the type of the drug that we select, will help us to predict the well-being of this patient. And we said the prediction of the outcome of treatment or condition is what we call prognosis. And we said the prognosis may depend on the stage of the infection, may depend on the biological makeup of the patient, may depend on the age, may depend on they may also depend on the immune system of this patient. So they may also help. This prognosis is very important, that we are saying it helps us to inform caretakers about the condition, or about the progress of the condition, and about the outcome of the condition. So that is what actually we have talked about for today. Unless one has a question, then we may be able to link up in the next session. But as of now, I wish we could go deeper and read these slides. And in case you have a problem, you can always contact me on 0784 754583 or on by email pedsonmasereka@gmail.com. Thank you very much. We meet in the next session. Thank you.